Hi, everybody. I'm Dr. Lucy Golden, and this is Weight and Gold, where we talk about the science and practice of weight health, overweight, and obesity. And I'm really excited to share one of our amazing clinicians here with you today, Tina Molinaro. She works with us at Weight and Gold in Madison. And Tina, why don't you tell us a little bit about yourself and what you do?
Yeah, thanks for the introduction. Like Dr. Golden said, my name's Tina. I've been a physician assistant now for just over 11 years. Started my career out in the ER, moving into the urgent care shortly after that, and really just saw, just to kind of speak how we ended kind of found myself with Weight and Gold, but in the acute care setting of the ER and urgent care, I saw a lot of patients with concerns that I was treating them for related to obesity, but really felt limited in terms of, being able to address the root cause for a lot of those concerns being related to weight health. So, loving obesity medicine just kind of as a specialty allows me to slow down and really listen to patients, hearing their stories and really providing that individualized care.
Yeah, I find a lot of us have ended up here because we've been in fields within healthcare. We went in for the right reasons, wanting to take care of people. And there's like almost a phase of a little bit of becoming disenchanted, right? Because we feel like we're not having that impact that we wanted to have. And in obesity medicine, I think that kind of meets that need. Is that something that you've experienced or?
Yeah, definitely. I think a lot of times too, we think about related to kind of how I ended up choosing obesity medicine as a specialty. So many things that I felt I couldn't truly help patients with fully. For example, chronic back pain or injuries related to, joint pain, etc. Sometimes, breathing related issues with COPD and heart disease. While I could treat the acute episode of what was going on, I felt there was so much more that could and should be addressed, but maybe a missing piece in their treatment plan. So just having that ability now to really treat the patient as a whole health model and not really just the acute care side of it. So.
Right. And then there's that other piece too. We hear a lot of patients talk about, I come in for back pain or knee pain, and I don't want to hear that my weight is the problem. Like you're talking about treat me as a whole person. That sure, maybe my weight could be a contributor to those things, but what else could be going on?
Definitely. Yeah.
Yeah. So what do you wish you understood earlier in your training or your career? I mean, I think a lot of us have gone through, maybe you're more wise than I was, but as a provider, I think I definitely went through a phase of being that provider that's like, oh, I don't prescribe that medicine. This is calories in, calories out, eat less, move more. This is the personal thing that you have to work on. I don't really have answers. And luckily we all learned. But what do you find that you wish you would have known earlier in your career about obesity, weight, how the body regulates all these things?
Yeah, definitely. I think, as we do in our schooling to become clinicians and of course, continuing education, I think we try and update ourselves, with medication changes and, treatment changes for diseases. So many of them, though, it's not always possible to know everything about everything, right? So I think in my training, especially, I wasn't as well aware about medication intervention for obesity and weight health, but also just kind of knowing that it's not just medication changes that need to happen, and really understanding the patient as a whole matters. Their history from childhood on, really, for a lot of patients, this is important. And I think it lends itself to just knowing that obesity medicine is so much more than just a prescription.
Yeah, I think that's so important with the pillars, as we often call them, with nutrition, activity, sleep, and stress, and behavior, and then medicine and surgery, and helping people understand that if we want comprehensive treatment, then we need to engage all of those things. Now, that's different than saying a patient has to be perfect to get the
Right.
treatment that they need, which is similar to other conditions. Do you notice that of how obesity almost seems to be treated differently than other chronic conditions that also have a lifestyle component?
Yeah, I think a lot of it speaks to just so many new changes in the area of obesity medicine in terms of newer medications coming out, but also there isn't a fair, I would say, comparison of obesity as the chronic disease that it is compared to other chronic diseases that are maybe better understood or more easily talked about in, for example, a primary care setting, or even other specialty care settings that may not understand fully what we can and do offer patients in terms of support for their obesity treatment. But yeah, I think the understanding of obesity as the chronic disease and not having a quick fix with the medication for weight reduction, really that sustainable small changes leading to long-term need for support really over
Hmm.
time.
Yeah, and that those changes can be hard to do if your biology is not well controlled, right? And I think that's the conversation that's often missed is like I like to think of it often as you do you want to learn to swim out in a rough ocean? Or do you want to learn to swim in a pool when you can get those skills down and then maybe you can be successful. It's kind of like giving someone the tools like when we give people medicine it helps calm down that biology so these small sustainable changes are attainable, are manageable. You can actually see success in them.
Yeah, definitely.
Yeah. Do you see have you seen the benefit, or can you talk about an experience that you can think of with a patient that has done the things, right? I mean, because I think there's this big assumption out there that, well, if we all just did the right things or tried a little bit harder, this would all be fixed. And sure, I mean, those we all have that 1% more that we could probably improve our lifestyle. Um, but for an individual that was doing all the things and then having the medicine and biology on board really changed their trajectory and possibly even the way they saw themselves.
Definitely. I think, 9 times out of 10, because, nothing is fully perfect in life. But I think when we see a patient, meet them where they're at with their needs and really kind of treat the biology, the patient will come back really after even just the first 4-week period on, potentially a medication to treat their underlying biology, be it fullness hormone, et cetera. And they will, for the first time, feel like their eyes have been opened to what they were able to achieve in terms of nutrition change when they were able to have the ability to make the choice and the knowledge to do so. So I don't have just one specific patient that I'm thinking of because it's really, like I said, for the majority of the time when patients are getting the correct treatment with the correct support and just adequate information and all of that in place, I think patients, they really, I always give the analogy of if you've ever seen a video of a young child, for example, who has vision assessment and then kind of gets their glasses for the first time and they like look to the side and they like see their parent or their mom and like just the way their eyes light up, this little kid with glasses for the first time, and they just are like, oh my gosh, they see this human that they've heard and felt and loved for so many years, but now they're seeing them. And patients
Mhm.
often, I feel like when they get those first experiences of their biology being controlled with medication, it can be really eye-opening. And they're just like, I had no idea. I thought it was me. I thought it was me. I didn't have the willpower to do it. And I think that speaks to just obesity medicine as a chronic disease. It's not willpower. It's a disease. There's medical process involved, and that's part of what we do is help patients understand that, empower them, yes, treat them, yes, but give them the education to understand what medication is doing to help them.
Mhm. It's so powerful. I mean, and that's what keeps us here practicing this, right? Is seeing that change. Like, I didn't know I experienced the world differently until it's been treated. And I love what you said about having it, giving them the ability to choose, and I think a lot of people that maybe haven't experienced what goes on in the brain related to obesity have this approach of like, just choose. It's really simple, just choose. And you just highlighted there, like, it's it's that ability to be able to easily make that choice that has changed for them.
Yeah, and I think also just highlighting for those patients that your journey is not going to look the same as someone
Mm,
else's journey, and that's okay. We're not, our bodies don't read the textbook, our bodies don't read the research study, and your journey is going to look differently, but also supporting them and knowing, meeting them where they're at on their own individual journey, and some patients do have, a strong reaction to medication, and others not as much. And it's always kind of working through all of those, um, individualized treatment plans, and supporting and answering questions along the way.
mhm. And how do you so say someone's had this great benefit, the medicine works for them, right? Is it fixed? Like, how long do we have to be on the medicine to get the body to work well on its own? Has it been corrected? Is it 6 months? Is it a year? Is it 2 years? And then I don't have to take it anymore? Or what has been your experience and your understanding of the science around that?
Yeah, and I think, that really is what kind of led me to finding Weight and Gold as a, career opportunity, because I worked with patients in the world of compounded medication while there was some FDA shortages and such. And I think a lot of those patients maybe didn't have that education piece in place of like, we're going to have a medication on board for weight reduction, and then the weight reduction happens, and then often in an area where maybe they weren't getting the support or information needed, it was kind of like, okay, the weight loss has happened. Patients were coming off of the medication, and finding themselves regaining weight and not understanding why, or maybe just not understanding the right steps to kind of continue getting the support. But I think a huge part of what we do as obesity medicine clinicians is helping patients understand we're treating a chronic disease. We're not curing a chronic
Mhm.
disease. And treatment, sustained treatment looks different for most patients, but in general, we do need these medications to continue supporting us through the rest of our lives. And whether that's, dosing discussion, obviously, insurance and affordability discussions, all of that comes into play, but really meeting patients where they're at and supporting their needs to continue their treatment long
Mhm.
term, helping them
Yeah.
understand why long-term treatment is needed.
Yeah, it's so true, and I think that still gets back to that, like, internalized weight bias stigma of, like, "I should be able to fix this," right? And the honest thing that we see is because it's a chronic progressive disease, the more likely reality that people experience is they'll probably need more medicine throughout their lifetime. I mean, is that something that you've seen or experienced?
Yeah, I think a lot of patients kind of come in with maybe at first with a conversation of, one, hesitation about starting medication for something like weight reduction, kind of getting over that hurdle, helping them understand the why, and then when we start having, weight reduction happen, sometimes they'll say things like, well, I really just want to find a way to, minimize the medications I'm taking. And absolutely, polypharmacy can be something that's a long-term concern, but I think we
Mhm.
find with explanation of continuing medications for treating our obesity, it can sometimes lead to decreasing doses and or eliminating other obesity related conditions, medications for that. But also, there's not just one pathway of treatment for obesity, and so sometimes when we get to optimize dosing, or kind of reaching a plateau point with one medication, we may need to consider other pathways of treatment, always kind of analyzing other related conditions that may develop or were not treated
Hmm.
prior to starting one medication. So yeah,
Yeah.
there is often a point in a treatment plan that patients do need to consider the possibility of adding other medications, decreasing
Hmm.
doses of medications for other related conditions. But overall, again, it's really empowering patients and helping them understand the why behind of it, all of it.
Yeah, you bring up a great point. I mean, because I remember I always tell patients like I love stopping medicines. It's one of my favorite things to do, right? So the idea, I understand the idea of not wanting to be on a lot of medicine, but we try to look at that of there are all these conditions, right, that obesity can cause. And what if we treat this one and then we can get off the medications for all these others? So, yeah, maybe we need one or two medications, three possibly, depending on the severity of our disease, not the strength of your willpower. And what if we need those to control the obesity and then all these other conditions and medicines fall off? To where we are reducing the overall volume and kind of burden of our medicine, and that's treating the roots rather than the fruits is often what people talk about, and that's what's exciting when we can see people looking at that too, because it's that other measure of success beyond the scale, right? Maybe my scale isn't achieving what I wanted it to, but I'm down to 2 meds rather than 7, or my blood pressure is controlled without anything, and my diabetes is controlled otherwise. I'm off my medications for arthritis. I mean, those are incredible off the scale wins that really change the conversation about why we're treating obesity beyond just like I want to be in a smaller body. Not that there's anything wrong with that, but medically we look at the other reasons why.
Definitely.
Yeah. Well, is there is there one thing that you just really wished that there's probably more than one, but you really wish that, people, someone, if someone's watching and like you just really wish they understood or knew about what they should expect care to be like around their weight.
I think the most important thing, and this has kind of just been from the start of my career in medicine, even before, is just really understanding the why. And I do think that it's important patients seek treatment and have the ability to have, non-stigma, non-biased care available to them, but also kind of knowing, yes, there is treatment available, but like what is going on, what has gone on in your body and in your life to kind of lead to this point, and knowing that we're taking medication, but understanding what it's doing for us, and why it's important to continue, using that medication. And that medication isn't the full answer. We do really, like we talked about the pillars, we do really, it kind of continuous points throughout a weight health journey, and need to continue to assess nutrition needs and ability for movement, however that looks for each patient, mental health, any disordered eating, stress, sleep, all of that kind of comes into play. And just knowing that at any given point, we can make small goals that can lead to sustainable change.
Mm-hmm. What a great reminder, because I used to think this too, like if I find one plan, it'll just carry me forward. And the reality is that depending on the phases of life we're in, we're going to need different plans throughout life, right? The plan that works for me as a college student is going to be a very different plan that works for me as a young mother or father, very different plan than what works for me when I'm retired, et cetera, right? And that's why working with someone long term to help you assess what your individual needs are at that time is so powerful and important.
Absolutely.
Well, thank you, Tina. It's been a great conversation. So glad to have you here with us at Weight and Gold, and taking care of our patients in such a compassionate way. And I'm glad we were able to share that with our watchers. And if this really helped you, please like and subscribe so you don't miss any follow-up videos and able to meet some more of our great providers. And if you need help with your weight health journey, come and see us at Weight and Goal.